bladder cancer. Remember that whenever you see painless and gross hematuria in an elderly male, then you will suspect bladder cancer. So for prostate cancer, a lower urinary tract symptoms and DRE will indicate a enlarged prostate gland, while in case of bladder cancer, the main presenting feature of bladder cancer is painless and gross hematuria. So an old male with painless or gross hematuria and with a history of smoking. Remember that smoking is the most important risk factor for bladder cancer. Along with smoking, occupational exposure to dyes such as aniline dye. So these are the two important risk factors for bladder cancer, that is smoking and occupational exposure to dye that are present in paints such as aniline. They can cause bladder cancer. So an elderly male with a history of painless gloss hematuria, who is smoker or who works in a paint processing plants, then you will suspect bladder cancer. To confirm our diagnosis of bladder cancer, the investigation of choice is cystoscopy. Remember that renal cancer and ureteric cancer, they can also cause hematuria. Gross hematuria can be caused by renal cancer as well as ureteric cancer, and it can be caused by bladder cancer. So if an old male or if an old person present to us with gross hematuria, then we need to rule out bladder cancer as well as renal cancer and ureteric cancer. While on the other hand, microscopic hematuria in a young patient can be caused by kidney stones. So remember these investigation whenever you encounter hematuria. If the patient age is above 40 years, plus there is frank hematuria, then we will do three investigations, that is cystoscopy to rule out bladder cancer, CTU, that is CT urography to rule out renal cancer and ureteric cancer, and cytology. So in older males who are above 40 and they present to us with frank hematuria, then we'll do three investigations, that is cystoscopy, CTU, and cytology. Cystoscopy to rule out bladder cancer and CTU urography to rule out renal cancer. Because the patient is old and he is presented to us with frank hematuria or visible hematuria or gross hematuria, then we need to rule out bladder and renal cancer by doing cystoscopy and CT urography. And if the patient is above 40 and the hematuria is non-visible, or if the patient is less than 40 years of age with hematuria, then malignancy is less likely, because microscopic or non-visible hematuria is mostly caused by kidney stones. So if an above 40 years patient with microscopic hematuria, or a patient whose age is less than 40 and he is having hematuria, then malignancy will be less likely, That's why we'll do ultrasound and followed by non-contrast CT scan of the KUB for stones.
Can you repeat, please? The ages, it's a little bit confusion.
Age is above 40 and frank hematuria or gross hematuria or macroscopic hematuria or visible hematuria. They are all the same things. Gross hematuria that is visible to the naked eye. So an old age patient who present to us with macroscopic hematuria, what is the age limit? That is above 40. If the patient is above 40 and he is having gross hematuria, then we need to rule out bladder malignancy and renal malignancy as well. To rule out bladder malignancy, we'll do cystoscopy, and rule out renal malignancy, we'll do CT urography. CT urography is basically, you can say that in CT urography, a contrast is given and then a CT scan is done. So this is for the patients who are above 40 and they present to us with visible hematuria or gross hematuria. Now, if the same patient who is above 40 and present to us with non-visible hematuria, non-visible hematuria is mostly caused by kidney stones. So if there is non-visible hematuria and the patient is above 40 or below 40, then we will do ultrasound, and initial investigation will be ultrasound followed by CT KUB.
So it's the patient can be above or below 40, but the hematuria is non-visible. So in that,
Yes, non-visible hematuria in above 40, malignancy is less likely.
right.
The third case is if the patient age is less than 40
Right.
and hematuria is visible or non-visible, doesn't matter.
Right.
In young patient, gross hematuria or microscopic hematuria malignancy is less likely. That's why in the patient who are younger than 40 years of age, and they present to us with gross hematuria, then you will not go for cystoscopy or CTU. You will go for ultrasound and CT KUB. Because malignancy is less common
Right.
below 40 years of age.
It's clear now.
So an old male with gross hematuria and a history of smoking, then we will think of bladder cancer. Though other cancers such as renal cancer can also cause gross hematuria in older patient, but in renal cancer, the presentation will be a little different. There will be a loin mass or loin pain along with hematuria. So whenever the in the scenario or in the question, it is mentioned that a patient, an old age patient, male or female, presented to us with gross hematuria, and there is loin pain or loin mass, then it will be a renal cancer. And if bladder cancer with painless or gross hematuria and a history of smoking or exposure to industrial paint dye such as aniline, then we will suspect bladder cancer. So some exam tips. When I will say it is benign prostate hyperplasia, And when we'll say it's prostate cancer, when we'll say it's bladder cancer, and when we'll say they are stones, and when we'll say that it's renal cancer. So for renal cancer, I have already told you that someone with a gross hematuria and loin or flank pain and loin mass, then it will be renal cancer because the location of the kidneys is in the loin region. That's why. So we have discussed that if the patient is presented to us with the lower urinary tract symptoms and digital rectal examination reveals a large, firm, and smooth prostate. So large, firm, and smooth prostate with lower urinary tract symptoms, it will be benign prostate hyperplasia. And if the same patient with lower urinary tract symptoms and digital rectal examination reveal hard, irregular prostate or nodular prostate, then it will be prostate cancer. Also, some other points in favor of prostate cancer will include weight loss, hematuria, and a locally invasive disease, and lower back pain in metastatic prostate cancer. So these are some points that will favor the diagnosis of prostate cancer. And when is it bladder cancer? A middle-aged elderly male or female who present with gross and painless hematuria. And there is a mention of risk factors such as smoking or occupational exposure to paints or dyes. So then these points will favor bladder cancer. And when you will say it's a stone, remember that renal colic is sudden in onset and there is a severe pain that starts in the loin region and it moves down to the groin region. And also the patient with stone will have fever, rigors, nausea, and vomiting as well. And the stones are common in young patients. So a young, relatively dehydrated patient who present with a sudden onset of pain that radiates from loin to groin. Also, there will be feature of nausea and vomiting. Then you will say it's kidney or ureteric stones. So renal cell cancer is also known as hypernephroma. Remember this classical triad for renal cancer: hematuria, loin pain, and abdominal mass. If these three things are present, then you will say it's renal cancer. And other presentation of renal cancer is left varicocele. So if an old male present to you with left varicocele, then you will suspect renal cancer as well. So either a classic triad of hematuria, loin pain, or abdominal mass, or a patient with left varicocele. Remember that testicular veins drain into the inferior vena cava and renal veins. So whenever there is a renal cancer, testicular vein will be blocked and it will result in the formation of varicocele. So sometimes in the exam, renal cancer is asked with the presentation of varicocele. Renal cell cancer can produce endocrine effects such as they can cause polycythemia because renal cell can secrete erythropoietin. Renal cells can secrete parathyroid hormone. So hypercalcemia or hyperparathyroidism can also be a presenting feature. And renin and ACTH may also be secreted by the renal cancer. So renal cell cancer can cause endocrine effect as well. Management is very simple. If the disease is defined or confined and limited to the local tissue, then a total nephrectomy is needed. Otherwise, tyrosine kinase inhibitors such as sorafenib and sunitinib, they can also be used. And alpha interferon and interleukin 2 can also be used to reduce the tumor size. So bladder cancer is smoker with asymptomatic hematuria. Renal stones will be a renal colic, that is sudden and severe onset of pain in the loin region that radiate to the groin. Prostate cancer will be nodular or irregular enlarged prostate with high PSA. And renal cancer will be loin pain or loin mass along with hematuria. And schistosomiasis can sometimes also present with hematuria, and they can also form a mass in the bladder. But in case of schistosomiasis, there will be a history of travel to Africa or Middle East. So this was all about the different types of urological cancer that included prostate cancer, bladder cancer, and renal cancer. All of these cancers were common in old age. Now, urological cancer that are common in young people. So remember that testicular cancer are common in young people, and bladder, renal, and prostate cancer, they are common in old people or older age. So is it clear, everyone, up till now? Is there any question?